Hi, good afternoon, everybody. Thank you very much for attending. Hi, my name is Gerald Lee. I am an assistant professor for the Department of Pediatrics, and again, we've had a lot of attention paid to Louisville. I wish it was the NCAA tournament, but it actually was allergies. The motivation of this talk is we actually were ranked the worst city in the country for spring allergies for 2014, according to the Asthma and Allergy Foundation for America. So I think when talking to a lot of patients, I think the thing we don't realize is that you actually can be in the worst city for allergies in the country and have no or controlled allergy symptoms. That's very profound, and it seems as though that in Louisville we accept allergies as a fact of life, and pretty much this is why I have this and I live here and I have to accept it. But I'm going to try to convince you that there are things you can do starting today. So pollen is obviously here. Anyone who has allergies knows that it's here because you can feel it. This is the pollen counter data that we obtained from the East End. Anything that is this angry orange color is high, and so that is the 24th, all right? High pollen, most of the month. So again, I just really want to review allergic rhinitis. Again, inflammation of the nose and eyes and so on due to allergies. So again, when I say rhinitis, the mucous membranes that line our nasal passages can be inappropriately inflamed due to something benign as tree pollen. And unfortunately, this is afflicting up to 20% of the United States population. And if you take all asthma and allergies in the country, we're talking about 60 million people. That kind of outranks coronary artery disease and diabetes as a prevalent condition. Now, I think I told you about the rankings. Last year, we were number 5. Unfortunately, we are number 1 for the country this year. So this got a lot of press. Now, again, we're not only known for allergies, but also things that can make allergies worse. Just to kind of have a perspective of why it's so challenging to live in Louisville is not only do we have the right climate to allow pollen to proliferate in our city, but we actually have a significant amount of environmental pollution. So the State of the Air survey is done by the American Lung Association. It looks at 2 major pollutants, which is ground level ozone, which comes from car exhaust and other kind of coal burning plants, but also particulate matter pollution. That's diesel exhaust that comes from the many trucks and UPS and other transporting companies that go through our highways. And actually the rankings show that we are number 17. I mean, we think of LA as a very severe, we're actually number 17 in the country for ozone, and as high as number 12 for year-round average particulate matter pollution. So if we take these 2 triggers that is actually unique for our city, you know, that is leading to a lot of the symptoms. We have beautiful days. We're all excited about Derby, but us, people in the audience, the horses, we are all affected by the same thing. That is basically the kind of the end result. So what is happening biologically? Well, we have these cells that line all our mucosal surfaces, the outer layers of our sinuses, our nose, our lungs, and they're called mast cells. Now, these mast cells have these little dots you can see. They're like little tiny purple dots, and each one contains histamine. So histamine is a substance, again, was designed to defend us against certain infections. But unfortunately, these mast cells can be inappropriately triggered for something benign as pollen. And the way that works is our body makes an antibody inappropriately against pollen called IgE, right? And so antibodies, as you know, stick to things and are supposed to neutralize it. Well, those cells I showed you, those mast cells, they have receptors that bind IgE and they hold on to them. So basically all your mast cells are coated with IgE. So let's say you're exposed to pollen. What happens is that your mast cell triggers and releases the histamine immediately. It happens within 5-10 minutes. And then, so as the mast cells release histamine in your nasal passages, that's that kind of tingling or burning or that sort of thing when you get exposed to the allergen. That is actually your mast cells activating and releasing this substance that causes all the symptoms of allergy, the itching, the swelling, the mucus production, and so on. So we think of like the Elite 8 for allergy symptoms. This is a little basketball theme, I'm sorry. Is the swelling of the nose, the itching and watering of the eyes, the drainage, the cough. If it drains to the back of your throat, it will irritate your throat and make you cough. The inflammation of your sinuses. If you're inflamed in the nose, your sinuses can't drain properly. They can infect headaches. It can be a trigger of migraines. If you have lower respiratory problems, it could trigger your asthma, and it actually can affect your sleep. So let's kind of quickly review some of these things, right? Again, it causes the end result. So the classic allergic salute is when you wipe upwards because of nasal drainage, you get a crease across the nose. Another sign of significant nasal problems is tissue use. I think we all have our bulk kind of Costco, Sam's Club levels of tissues. You know, it can be a little overwhelming how much we're using that. And what's happening in the nose? Well, again, this is a normal nasal passage. Air usually goes in and out very easily. In the context of allergies, swelling, mucus production, you could see how it just shuts down. It completely closes up. If I look into your nose and you have allergies, this is the sort of inflammation I'm seeing. Your body's reaction over time causes this swelling and inflammation in your passages. So eye inflammation, unfortunately, you can get redness, wateriness of the eyes, and you can get kind of this dark circles. As you get congested, you get some darkening and light and inflammation of the eyes. I told you about lower inflammatory, dripping that can inflame your throat. Again, if I looked in your throat, I'm sorry you're eating lunch, I apologize, but you get kind of cobblestonings of the throat. Actually, that's the irritation from the drainage going posteriorly. The sinuses, as you know, we have these pockets of air to kind of keep our head light. But again, if there is inflammation that blocks the drainage, then fluid accumulates. And unfortunately, that can lead to the infections, the headaches. You have to get antibiotics for that, and so on. And the root cause of that can be allergies. So again, we all see people kind of do like this. They feel that pressure type sensation, though it's not a specific sign. Again, if you kind of drop out of the NCAA tournament, you could have headaches that look like this. So you don't know if it's sinusitis or not. It's kind of hard to tell. So allergic rhinitis and asthma are intimately linked. We do know the airway is one unit. So inflammation up top can make asthma worse, and inflammation down below can make your sinuses worse. So actually, when I see someone who has a respiratory problem, and the first question in my mouth is, how do you feel up here? Because sometimes we take a lot of inhalers, but we're neglecting a common trigger of why someone can have a lower respiratory issue. We know that allergic rhinitis occurs in up to 85% of people with asthma. And certainly people with asthma, half of them probably have an upper respiratory allergy condition. So you have to consider both if you want to have good control of both. Sleep disturbance is underappreciated, I think, as a consequence. Studies have shown that only 3% of people with allergies have a good night's sleep, right? And sleep affects everything. It affects your blood pressure. It affects your job performance. It affects what you want to achieve in life. This is an attributable cause that we can control that actually has broad-reaching effects. We only consider what we feel, but there's actually other ripples from allergies. So again, that's kind of our elite 8 of symptoms. So what is causing our allergies? What's in the air? Well, pollen is the low-hanging fruit. We know that when we walk outside and you're allergic to tree pollen, that is what's blowing into your face. Again, and we have a high pollen count today, right? The typical 3 seasons for Louisville, tree pollen is February through June. There's grass pollen April through July, and wheat pollen August through October. Now, mold outdoor sources of mold are typically fresh cut grass or leaves. Again, anything that's in the ground or in the soil. Obviously, when you mow the lawn and you're kicking up mold, you are actually blowing that into your eyes, your nose, and you're inhaling that if you're mold allergic. Mold spores typically are released just like pollen in the late summer and fall. Now, again, we can't always think about outdoor allergies. There's indoor allergies, furry animals, dust mite, cockroaches, and indoor mold, your bathroom, your basement. If you have humidifiers, I'm actually nervous about humidifiers. It's a warm, wet environment. I think of them as, is that a culture dish for mold? Are you cleaning that regularly? I mean, I would look into that if you do use humidifiers in your home. But everything doesn't have to be allergies. Common indoor irritants can also cause the same symptoms or concurrently make things worse. Everyone sees these commercials that you can make your air better by putting something into the air. Let's put a chemical into your air that smells nice, and suddenly you make your house better. But remember, there's a consequence to that. Some people are very sensitive to Febreze, perfumes, incense, and then of course tobacco smoke is a common indoor irritant. Now, in order to convince myself that you have an allergic cause at least, what I do is I have to just scratch the skin with the allergen, and if your body doesn't like it, those mast cells in your skin will start releasing histamine. You'll develop like a hive, it looks like a mosquito bite, and I'll give you the answer in 15 minutes what you're allergic to. And actually, when you walk out of my office, I'll tell you exactly what is causing all these symptoms, all right? Now, again, I just play this for fun. This is like, I think is the #1 enemy, and I don't know if it's going to play. So if it doesn't, what I'm going to do is I'm just going to do it because I just think it's fun. It has nothing to do with the talk whatsoever. But it's just something I saw on YouTube, and I just think it's impressive. Isn't that amazing? I mean, I just feel terrified just like seeing that. I mean, again, that's what's blowing around all around the city. That's why we're having high pollen counts. Again, that's just one tree alone, right? Imagine that all the trees in this entire city doing the same thing, or at least in southern Indiana as well. Because, you know, they travel for miles. Those little pollen grains, they can travel for miles. So again, if you're a pollen allergic, while you're indoors, you gotta keep your windows closed. Run the air conditioner. When you're coming in from outside and you've been outside all day, remove all your clothing. Get the pollen off of you. If you're going to be exposed outside and you're going to be doing a lot of stuff like mowing the lawn, you're mold allergic, maybe you should wear facial protection. And then again, you can watch the pollen counts to decide how much activity you want to really do outside. Now, I use this website, pollen.aaai.org. That calendar I showed you actually shows you that data. Now, here's a good tip. If you carry your smartphone with you, sometimes you get that email pinged to you. What I do is I actually sign up for an email alert. When I walk into the allergy clinic, I usually get an email if the pollen count is high. It comes around 7 a.m. I actually know what the pollen count is before I see my first patient for the day. So you can be armed with the same information I am. So pets, I've come to terms with pets as an allergist. I realize that pets are like a family member. So removal of a pet is like telling them to give away your own son. So I kind of come to grips. So again, if we think of the continuum of pet exposure, no pet is the happiest, and then think about the other spectrum as suffering. There's no pet, outside pet, pet to one floor, or pet in your bedroom. So again, anything you do to make safe spaces in your home, especially where you sleep, would be the most. 6 cats will be very challenging. Again, if you could contain them in one area, that's the best you can do, honestly. So this horrific creature from like the Aliens movie is actually a microscopic mite that is in all our environments. It's called dust mite. It's in carpets, curtains, mattresses, and pillows. They use humidity to get their moisture. And basically, they live primarily in your home environment. So what we recognize is because they require humidity to drink, you want to try to keep humidity on the lower side. You don't have to be bone dry, but don't introduce unnecessary moisture into your home. Regularly vacuum your house, wash your bedding in hot water where they live, and then you can encase where you sleep, where you lie flat. Your nose is right next to the pillow and mattress where dust mites live. Protect yourself by getting impermeable covers. That's in any home store like Kohl's, Bed Bath & Beyond, Walmart, Target, any of those places. And so if you have your bed that's full of stuff, you want to encase your pillow and mattress, zip it closed, and put a barrier between you and the dust mite in your bedding. Now, cockroach, again, hopefully most of us don't have pests like this. Just make sure you're very clean with the food and other things, especially your kids. For mold. Now the problem with mold is that when you have a water leak and it involves drywall, if it's not remediated immediately, you could see that someone stripped the drywall and behind in the insulation, mold has grown. So if you had a major leak event, especially in a hard rain, you actually want to make sure it was remediated quickly, because if the water stays in a damp environment within 48 hours, our belief it is probably involved with mold, and you actually have to probably physically remove that affected area. So try to fix leaks as fast as you can. Check for condensation in your windows. Avoid humidifiers if all possible. And then if you see mold growing on drywall, I would replace it. Surface cleaning is, again, not going to take care of mold occurring behind the affected area. So I told you about what to avoid and what not to avoid, but seriously, everyone in this room is going to walk outside. Again, you cannot be in a bubble and trap yourself in a vacuum. So what can we do? You must be protected if you have allergies. And so we have a lot of effective treatments. And so my thought, I'm going to go over some over-the-counter prescription and, of course, allergy shots. So rinsing. So rinsing gets a bad rap. People consider it like waterboarding or torturing yourself. The way you really do the rinsing is, if you think about it, if you have all this mucus and obstruction in the nose, number one, you can't breathe, but number two, you're trying to use medicines and you can't get medicines in there. So at any pharmacy, you can either get a bottle or a neti pot. You put a clean source of water, something that you've boiled or, something that you've boiled or you've used distilled water. You add a salt packet and it goes in one nostril, out the other, and gets all that stuff out of there. And actually, if you use a nasal spray afterwards, you're putting it into a clean nose. That's very effective. So again, I usually recommend that for all our patients. Now, antihistamines. Antihistamines for me is like Coke and Pepsi. I don't really have a strong feeling behind one or the other. I would say in general, a daily antihistamine would be helpful if you're allergic, with Claritin having the least side effects, cetirizine having the best price performance. But if you think Claritin is too wimpy and cetirizine makes you sleepy, then a good compromise is Allegra. It's just that it costs more. That's all. So again, a good tip about antihistamines is if you know that you need an antihistamine and you need to take it every day, my suggestion is that if you have a warehouse membership to Costco or Sam's Club, you can get a year's supply for $17. The same amount would probably cost maybe $60 at a local Walgreens. So there's a huge delta if you have, that would probably pay for your membership alone, you know what I mean? So just to think about it. So if I only had one medication in the world to treat allergies, the nasal spray, i.e. putting medicine exactly where the problem is the #1 most effective medication for allergies. The generic one is this one, Flonase. We actually now have an approved over-the-counter one you could pick up today that's called Nasacort. Okay, and basically it's 1 to 2 sprays each nostril once a day. It treats all the symptoms for allergies. There isn't a side effect of bleeding of the nose, but if you avoid the middle of the nose, if you spray it toward the ear, you can reduce that side effect. So again, if you decide to pick up an over-the-counter nasal spray like Nasacort, try to avoid spraying the middle, point it toward the ear. Now, there's also intranasal antihistamines. Those are only prescription. I think it's less effective, but at the same time, it's better for as-needed use. For a nasal steroid that has for a nasal steroid like Flonase, you have to take it every day. For the person who wants to take it once in a while, this would be a better choice, though they taste quite awful. I would bend forward and try not to get it to the back of your throat. There are intranasal anticholinergics, but I only give those people who have a lot of wateriness, and most people have congestion and watery nose. So let's talk about Sudafed. People say, I gotta have the D. The regular doesn't work. I have to have the D version. So what that tells me is you have pretty significant allergies, and yes, a decongestion can be helpful, but side effect wise concerns me is that it actually has effects on your heart and blood pressure. So my question is, can we give you a therapy that will help you, that won't give you unacceptable side effects like hypertension, right? So again, I would actually encourage you that if you feel like you must have the D version of antihistamines, then you probably should think about a spray or seeing your physician about that. A small caution about intranasal decongestants. When you use an intranasal decongestant like Afrin, it works so well. You spray it and you open up immediately. The problem is if you keep on using it every day, you actually become quite dependent on it. The rebound after continued use of an intranasal decongestant is quite horrible. And then I see people and they have Afrin everywhere, in their glove box, in their coat, in their pocket, their home, their bedroom. So you get very dependent on it. So to avoid getting into that cycle of dependence, I actually would try to minimize the use of those as well. So Singular is, I think, or Montelukast is thought to be an asthma, allergy, jack of all trades, master of none. So I would say that if you had concurrent asthma, you could try that medicine. But again, for this level of allergy, I think as single therapy, I think you're going to need a little bit more. For people with eye drops, over-the-counter eye drops include Ketotifen or nafazoline, I'm sorry. So those are effective. If you don't like to take it twice a day, there is a prescription once a day like Patanol, which can be effective. Now let's talk about desensitization. Step 1 is, what are you allergic to and can you avoid it? Step 2 is, you can avoid it, so you can at least have medicines so you don't have symptoms. So step 3 is, can I teach your body to be less allergic so you reduce your medication requirement? Some people take 3, 4 different medications to control severe allergies. Can I teach your body? And that's possible now. Allergen immunotherapy over time is a way that we deliver the allergen to educate your body about allergies and reduce symptoms, reduce medication use. It actually has been life-saving for people who are allergic to bees and wasps. We actually can make them not allergic so they don't have to worry about a life-threatening allergic reaction. And interestingly, there has been preliminary data to show that if you have a young child with allergies and the start of asthma, a lot of these children with 3 years of immunotherapy was shown to not develop asthma later in life. We wonder that can we prevent some kids from actually developing lifelong asthma by intervening on them early. Now there's 2 options now. The first is the traditional allergy shot, but just this month there have been 3 products approved for a underneath the tongue desensitization called sublingual immunotherapy, and I'll tell you about that in a little second. All right, so immunotherapy is not for everybody. What would concern me are people who have very severe asthma, who are on medications for the heart like beta blockers and ACE inhibitors, and for people who are planning to get pregnant. You probably wouldn't be better with medical therapy, and because there's a slight risk of triggering the immune system, i.e. breaking out in hives. So we want to make sure it's safe before we do it. So if we're going to do shots, what I'll do is I'll test somebody and I put what they're allergic to into this 1-to-1 vial. Now it's very strong, so I have to start at a dilute amount. So I usually do 10-fold dilutions. I start them at about a 1,000th of the concentration or 10,000th, and I kind of build them up slowly. All right. So our sheet looks like this. There's about 10 shots per vial. As you know, I give them a smidgen of a 1 to 10,000, and I slowly build you up in a safe fashion. And with each injection, given typically two times a week, we educate your body to what they're allergic to. And by the time I get you the top dose, after 3 to 5 years, what we find is that we can start spacing out the shots every other week, every 3 weeks, every 4 weeks. The mean duration is 3 to 5 years, and when we stop, usually children and adults have long-term tolerance, 5, 10, 15 years. We can actually shut it down even after we stop the shots. It actually trains the immune system. Now, some people have come to me, oh, I had shot 20 years ago and I got my symptoms again. Well, I think that's fantastic if you had 20 years of benefit. But yes, it doesn't last forever. Now, people worry about safety. Yes, I'm injecting you with something you're allergic to, so there is a risk of allergic reaction. People have quantified this risk. The actual estimate is that the risk is around 0.1% of like breaking out in hives or having allergic reaction. The severe reactions would be on the order of about 5 in 1 million. So again, it is a very safe therapy, but again, because of that, you need a physician to administer it. You have to do it in a doctor's office. Now, that is for injections. Let's talk about what just got FDA approved. So there's two categories of products on the market. One is for grass pond. Grass is from April to August, and ragweed is from August to October. So if those are your particular sensitivities, what I'm able to do is I'm able to prescribe a dissolvable tablet that you put underneath the tongue. You start that maybe a few months before your pollen season. You do the first one in my office, and then you take it home with you, and then you put it underneath your tongue every day. You don't have to come to the doctor's office. You don't have to wait. This can be done at home. And over time, you have that 3-month kind of head start. You train your body to be less allergic, and there actually has been a significant decrease in symptoms in this tablet immunotherapy that just got approved. So I'm very excited. I think a big barrier for allergy immunotherapy in my practice is people who just don't have the time to come to the doctor's office. They have, we're all very busy here, and this is something you can get the benefits of desensitization without allergy shots, right? Now, what's the downside? Well, the downside is that unfortunately the majority of my patients are polysensitized. There's very few people in my office that are only allergic to grass, that are only allergic to ragweed. So again, if you feel like you want to treat all the allergies, I probably need to make a custom prescription for you. But if you feel that logistically it's impossible for you to get shots, at least something's better than nothing. I can at least give you some sort of benefit during the pollen season, all right? So again, I'm not sure I'm gonna have this in my office in time for this year's ragweed season, but certainly for next year, I'll definitely have this available. Now, what is the side effects? I told you about the risk of allergic reaction. So again, if you have uncontrolled asthma, if you're on medications for blood pressure, it should be something we should give carefully. But usually the most common reactions is you get an itchy mouth, right? Because you're allergic, right? So you feel a little itching underneath the tongue, maybe a little swelling. So anyways, I hope I've given you an overview of kind of what you can do in the worst allergy city in the country. I can tell you that most of the people who undergo an evaluation and we find the triggers, we set up the right medicines to make sure that even if you're exposed, you're controlled, and then desensitization, we can give you relief if you're having significant allergy or asthma or sinus symptoms. And again, there are a lot of over-the-counter therapies that are available, but again, if you feel that they don't work or you're not interested in medicine, there are other options available. So again, that's my information. I'll be happy to answer any questions if you have them for me. Yes?
Actually, I just had a comment of a personal experience. Hopefully it is hypothesis generating enough to be tested. I have been terrible with allergies all my life. And my gosh, every spring, every autumn is awful, and I take daily antihistamine. But I have been on a plant-based diet for 8 weeks, and to my utter surprise, I've had very little allergy symptoms this spring. Now, the benefit of plant-based diet in cardiovascular disease, and one of the hypotheses is that it reduces inflammation. It has also been used to treat fibromyalgia by a couple of physicians in town successfully. And so, could it be tested in the clinic? A strict plant-based diet may, in fact, negate all the inflammatory aspects of allergy.
I mean, again, it would have to be studied. So if you send it to me, I'd love to look at it for sure.
No, I don't have anything to send it to you. But
Okay.
I'm just on it. And
Oh, well, do you have the
my
diet?
pages,
Can you send me the diet?
Well, the diet, no, I'm not as strict. I mean, the strictest diet is Dr. Esselstyn's diet, which you can, Dr. Campbell and Dr. Esselstyn,
Uh-huh.
he is one at Cleveland, Frank Campbell is at Columbia. They have been using the diet to treat severe cardiovascular disease
Mhm.
with no medication and with reversal of blood artery thrombosis or occlusion. In fact, there's a very famous lady in town here. She's 86 years old. She had complete carotid occlusion and she refused surgery. She went on this very strict diet and her artery reopened by itself. And there is significant decrease in inflammatory manifestation of disease with a strict plant-based diet.
So again, if I give you my email, could you send it to me?
Yes,
All
I
right.
can send it to
All
you.
right. So again, I don't know anything that hasn't been evaluated by research, but again, I'm always open for other avenues for my patients. Yes.
For the under-the-tongue tablet, and right now you said this is for the pollen from the right. Is it possible, are they looking into having it where it can be for other, my allergy is mold, and so, but then you don't really want to think about putting mold on your tongue, but, so do you think, is that something that?
The one on 2015 is dust mite. I am not aware of a mold down the FDA pipeline.
That's pretty gross too.
Yeah. Yes.
Like you put a real dust in.
Yeah.
Speaking of dust mites, if you have a child who's highly allergic to dust mites and asthmatic, should their room be in the basement of your house if you're talking about the humidity level?
So again, if you have a damp basement, that probably would be not the best choice. All right.
Can I
Yes.
just paper this so I can show it to my
All right. Okay. Yes.
Two questions. Germist, is that one of the nasal sprays that need to be, if you start on them, you should use them every day?
Yeah, they work best with every day because again, if you had a rash and you applied the cream once, usually the rash is going to be there, right? It requires continued application to control inflammation. And really, if you think about it, what does it do? It prevents the immunologic reaction. If you're pollen allergic and you walk outside, the days that you don't have your armor on and the medicine on, your immune system is getting stimulated. Do you know what I mean?
Right. I
So
started
during your
with
season, it'd be
vials.
important. Yes.
So right now, I just finished my first vials. So I get a shot in each arm.
Yes.
I've been going 3 times a week.
Great.
And yeah, they're wonderful. So I tried to not use all of my other stuff. Kind of started using it on my off days.
I would say if you're not on the red vial yet, the 1-to-1, you're probably not at the target dose yet if you just started.
And my other question was I call it my pollen arm, the shot like in my left arm, I get knots
Yes.
under the surface and bruising. I bruise badly.
Yes.
My other arm, I don't get knots and I don't get bruising. So should I drop down to less than 3 times a week? Or is
No, I would say that again, those knots that you're experiencing your on is very common with allergy shots. So it really depends on how bothersome they are for you. If they are bothersome and you're taking a daily antihistamine to try to reduce it, have you tried that first?
I have a compound allergy pill. It's compounded. It's a Stahist after they took Stahist off the market.
Okay.
So I have it compounded.
Yeah, if you're still having the reaction despite taking an antihistamine on the day of the shot, then again, they could either slow up your building phase or you might have to just kind of get over the hump, right? Again, we're educating your body, but again, there are side effects. You are allergic to the shot, so we just kind of have to, you have to kind of risk, well, I wouldn't worry about it, but again, it's dependent on how bothersome it is to you, all right? Any other questions? Yes.
Does your body go through seasons, not just the seasonal allergies, but is it possible that you could be allergic to something one year and not the next? Or, I mean, at one time I was on shots for like mold and tree pollen, all the stuff, everything you breathe. And I was on, at that time they had the drops out that you could put under your tongue, and then all of a sudden they were gone. I decided at that point, just forget the shots because I don't like them anymore. Went through a honeymoon phase, I guess is better than any other term, where I was feeling okay. Then I got really bad, went back on all my antihistamines and stuff. But all of a sudden, I didn't have any problems at all, and I got to come off the antihistamines. Now I'm suffering again. That's probably been a 5-year phase where things were up and down and up and down. So do you have, is it the air that changes, or is it your body that changes?
I mean, there's so many, again, I think I told you all the variables to consider. What to consider is what's your current level of exposure, has that changed over time? What medications were you on or not on at any of those times? And the role of desensitization. You were getting desensitized. Were you on the target dose? When you're off of it, were you getting some sort of benefit and now it's petering out, and that sort of thing? When you have those 3 variables, it's hard for me to attribute it one to the other why you're having symptoms sometimes and not the other. Right. Any other questions? All right, thanks for, oh yeah.
Outgrow allergies, did they ever go away?
So most people believe that your sensitivity can decrease over time, but I would say that if you've had allergies all your life, my experience is most of them continue to have those positive tests. I would say that a lot of my adult patients, they remember having childhood symptoms and they're still skin test positive. Your body makes a decision about allergies very early. Now, one thing is underappreciated is that sometimes their allergic symptoms are worse. Well, never used to be that bad because they're developing a non-allergic component. So mixed rhinitis can be another cause why an older person is now getting worsening symptoms. They actually have a second problem on top of their original problem. Yes. Yes, absolutely. That's my information. Yes. All right. Any other questions? Thank you very much. Oh, yes.
I just have a quick question. My allergies have just gotten worse and worse and worse, so I'm going to actually try the plant-based thing. But anyway, in the past year, I've moved on from airborne allergens to now contact allergies. Is there a link between the two, or do I just have a not so good immune system?
So in terms of mechanism, the mechanism for a contact allergy of the skin is different. It's a different type of immune. What I showed you there is different than contact allergens. But certainly we do believe there are certain people, unfortunately, have a genetic predisposition of having multiple types of allergies. And it doesn't surprise me that certain ones run together. So yes, it is, in terms of risk factors for allergy, genetics and family history is a strong predictor of people. I see it amongst children and their kids and their brothers, sisters, and so on. All right, thank you very much for your time. Yes.
Thank you.
All right.